Hello, friends and colleagues of IADR. My name is Marco Perez, and I am the IADR Vice President candidate. Let me introduce myself. I am a dentist, graduated from the University of São Paulo, USP, Faculty of Dentistry in Brazil, with a PhD in epidemiology from USP and University College London. After almost 20 years at the Department of Public Health, Federal University of Santa Catarina in Brazil, in 2012, I was appointed as a professor in population oral health and director of the Australian Research Centre for Population Oral Health, ARCPO, School of Dentistry, University of Adelaide in Australia. In 2018, I took a position as a professor of dental and oral health research, School of Dentistry and Oral Health, Griffith University, also in Australia. Currently, I'm the Deputy CEO for Research, a Senior Principal Investigator at the National Dental Research Institute, Singapore, and Professor and Director of Academic Clinical Program in Oral Health, Health Service and System Research Program, Duke NUS Medical School in Singapore. My research areas of interest include the effectiveness of oral health-related policies, health service research, big data linkage, oral health surveillance, fluorides, inequality in oral health, global oral health, life course epidemiology, and the relationship between oral health and general health. I was the president of the International Association for Dental Research Global Oral Health Inequality Research Network, and I am a member of the Lancet Commission on Oral Health. I have been cited in a paper published in 2016 in Community Dentistry and Oral Epidemiology as the 7th most productive research in public health dentists in the world in the last century. I also have been cited among the top 2% of scientists in the world in 2020 and 2021. I was the recipient of the 2017 International Association for Dental Research Distinguished Scientist Award for Global Oral Health Research. Since 2022, I have had continuous funding grants from Brazilian, Australian, and Singaporean agencies grants over this period totaling over 15 million American dollars. I have supervised 40 postgraduate students, authored 3 books, 15 book chapters, and more than 208 peer-reviewed papers. My work has received more than 23,000 citations and an age index of 83. As the IADR Vice President, I would like to contribute to the IADR commitment to continuously foster dental, oral, and craniofacial research of the highest scientific standards around the world. I would facilitate platforms and activities for our community to discuss key issues like research funding opportunities, integration of oral research with broader relevant topics and areas, and promoting diversity, equity, and inclusion in research. I'm committed to engage all members with special attention to less represented groups, particularly from low and middle income countries, to advocate for policies to increase diversity and inclusion and to improve access to IADR activities for all peoples, regardless of race, ethnicity, gender, sexual orientation, disability, citizenship, socioeconomic conditions, and religion. I have been working in academia since 1989. I am IADR Vice President candidate because of my strong commitment to raise the global profile of oral health research and my determination to support and nurture the next generations of oral health researchers. I'm strongly aligned with the IADR goals of fostering the highest standards of research and professional training and serving the community at the international level. My candidacy brings, along with commitment to the highest level of science, a strong commitment to challenge the historical roots of social injustice, to enhance the intellectual, social, and emotional functioning of the IADR members regardless of their gender, ethnicity, race, nationality, age, sexual orientation, and religion. My experience in research supports the strengths of my aspiration. For over 30 years, I have worked in academia in different social, cultural, and academic environments. During my career, I have made many research contributions, mainly in life course epidemiology, the assessment of the impact of health policies on oral disease, health service research, inequalities in health, and the relationship between oral and general disease, as well as in leadership in professional organizations in epidemiology and dental public health. I have mentored nearly 100 young career researchers. I worked and studied in Brazil, the UK, New Zealand, Australia, and since 2020 in Singapore. I have been working several international collaborative networks with academics from across 5 continents, with the WHO, NCD Alliance, FDI, and civil society movements in areas such as the social and commercial determinants of health and the effectiveness of health policies to tackle the burden of disease and reduce socioeconomic inequalities. I have been actively involved with key stakeholders in several countries. I was born, lived, and worked for many years in a middle-income country, Brazil, having moved into Australia and Asia, Singapore. I'm fluent in Portuguese, my mother language, and English, able to communicate in Spanish and with a basic knowledge of French. As a member of a large group of Brazilian dental public health researchers who studied in London, I have been heavily influenced by the late Professor Aubrey Shiham at University College London. The defining characteristic of this group is a commitment to tackle socioeconomic inequalities and foster social justice in oral health. I have paid particular attention to cultural diversity and social equity. I was a founder member of the Federal University of Santa Catarina in Brazil Committee for Affirmative Action and was a commissioner of the University of Adelaide, Australia, Equity and Diversity Committee representing the Faculty of Health. I'm committed to engage in work and education activities that reflect IADR commitment to diversity, equity, and inclusion, to offer opportunities to engage all members with special attention to less represented groups, particularly from low and middle incomes, to advocate for policies to increase diversity and inclusion and to improve access to IADR activities for all people, regardless of race, ethnicity, color, gender, sexual orientation, disability, citizenship, and religion. I would like to thank IADR for this opportunity to serve our community, and thank you very much for your attention.